Hello. Thank you for joining me. How you guys doing? So, in my quest to learn about Switzerland, well, one of the most interesting aspects of a country to me as an American is its healthcare system. Considering the United States healthcare system leaves a lot to be desired in terms of the financial aspect of it, okay? The quality of the care is good, but a lot of people can't even afford the care. And so you have a lot of people who are injured or sick and don't even go to the hospital. In that way, it's kind of a disaster. People going bankrupt because of healthcare bills. Pretty stupid, honestly. So I'm always interested to see how other countries do it. Switzerland's healthcare. And I used to think, growing up, you're kind of told, here in America, we all have to pay and it sucks. And in other countries, it's all just free. you know and the system, I just assumed everywhere was kind of like Britain, with like the NHS. In reality, it's a little more complicated than that. There's different systems and stuff, usually like hybrid private and public insurance models. Anyway, let's see how Switzerland does it. I have no idea. So check out Healthcare Triage, link down below. Let's go. And I suspect their healthcare is very good, just because they're a very rich country. So let's see.
Switzerland. It's a gorgeous alpine nation of 8 million people. It's a parliamentary republic made up of 26 cantons. I've never been, but I hear great things about it. The country should feel free to fly us over there so we can learn even more. But what I do know about its healthcare system, I'll be telling you today, here on Healthcare Triage.
Okay.
Like pretty much every healthcare system we've discussed, except the United States, Switzerland has universal coverage. Since 1996, the Federal Health Insurance Act has mandated that all residents buy statutory health insurance, or SHI, from private insurance companies.
Oh, okay. So they're mandated to buy private insurance. I kind of wasn't expecting that. We actually did have that here in the States under Obama, under the Obamacare. It was, well, I need to hear more about this. There's probably some. I'm sure there's differences, but yeah, it was mandatory to buy health insurance here in America for a while from a private insurance company. And then they repealed that. So you no longer have to have insurance anymore here in America. Trump repealed that, of course. Then again, it wasn't exactly like a perfect solution anyway. People were still going bankrupt and stuff.
SHI from private insurance companies. Everyone, and I mean everyone, is insured. If you move to Switzerland, you have 3 months to buy a policy, and it's retroactive to your arrival. The country even works to cover undocumented immigrants. SHI is offered by competing nonprofit insurance.
So it's retroactive to your arrival, meaning if in the 3 months that you don't have insurance, you get hurt or sick, you're actually still covered by the insurance you haven't even bought yet? So couldn't you exploit that by just buying really good insurance? Like if you get really sick, you can then buy really good insurance.
Companies. In 2013, the average premium for a policy with a 300 Swiss franc deductible for an adult ranged from 3,500.
I'm sorry. The average premium for a policy with a $330 deductible for an adult ranged from $3,950 to $6,675. Okay. That's for a year? That's pretty good.
91 Swiss francs to 6,070. Premiums can vary by geographic region and age.
I mean, it's decent.
There are 3 groups: children up to 19, young adults 19 to 25, and adults over 25. Premiums can also vary by acceptance of a managed care scheme. In 2011, more than half of the Swiss chose basic coverage with a managed care insurer. Coverage, like in most of the countries we've discussed, is comprehensive. You get physician services, drugs, medical devices, home health care, and preventive services like screening, immunizations, and exams. Unlike some countries, dental care is not covered. Eyeglasses and contact lenses are only covered for children. Insurance is not coupled to employment. Individuals buy policies and separate ones for their dependents. There's also voluntary health insurance.
So that's a difference. In some ways, this is actually more similar to the United States than other countries. But here in the States, most people are getting coverage through their employer.
Insurance, or VHI, which covers stuff not in the basic plans. This could include a better choice of hospitals or doctors, or improved amenities. Switzerland has a fairly high level of cost sharing. All plans have to have a minimum, yes, minimum deductible of 300 Swiss francs, or about $325 for adults. You can get a plan with a higher deductible, to a maximum of 2,500 francs, which comes with a lower premium. Plans generally come with 10% coinsurance above the deductible for most services, 20% charge for most brand name drugs, and a 15 franc copay each day you're in a hospital. Prices are set by SHI and doctors can't charge more. Maternity and preventive.
So what's SHI? Swiss Social Health Insurance. So there is like a publicly funded health insurance or publicly run health insurance option? Oh, no, it is all private. This is actually quite interesting because of all the systems I've seen, this one seems like it would be actually pretty easy for the United States to transition to this system to have just a more accessible, better system. And it wouldn't be that difficult for us to transition to a system like this.
Care are exempt from all copays, as are children who are in the hospital. There's a maximum on all out-of-pocket spending of about 700 francs for adults and 350 francs.
Okay, wait, that's a major difference. There's a maximum on all out-of-pocket spending of 750, but didn't they just say that the deductible could go up to $2,715? So how can the deductible be bigger than the max out-of-pocket?
Franc copay each day you're in a hospital.
Sorry, guys, I might just not be doing a good job at comprehending this. Sometimes I'm thinking while people are talking, and yeah, I get all scrambled up.
Prices are set by SHI and doctors can't charge more. Maternity and preventive care are exempt from all copays, as are.
Okay. So when he says prices are set by SHI, that is like a major difference. And I wanted to make sure I caught that. That's a major difference between Switzerland and the United States. So there's a national fee schedule in Switzerland, and you can't have providers just charging their own kind of arbitrary prices. They've already been negotiated by this centralized authority. Whereas here in America, it's just like the Wild West, and they can charge whatever the hell they want to different insurers or to people who are uninsured. And the weird thing about the U.S. system, there's a lot of weird things about the U.S. system, but one weird thing is that some hospitals, if you're uninsured, you'll pay less than what they would typically charge the insurance company. They have programs where you get a major discount for being uninsured, which is pretty weird. It can make these weird situations where having insurance is almost not worth it.
Children who are in the hospital. There's a maximum on all out-of-pocket spending of about 700 francs for adults and 350 francs for kids. Those at the low end of the socioeconomic spectrum get the same private insurance as everyone else. They just get help buying it. Subsidies are given to the poor on a sliding scale. About 29% of people get such subsidies to help them buy insurance.
It makes sense to have a sliding scale, whereas here in the States, we basically just have a cutoff. You have to be very poor to qualify for Medicare or Medicaid. Medicaid's the one for poor people. Medicare is for old people. But yeah, Medicaid, you have to be pretty poor to qualify for it. And as far as I know, you either qualify or you don't. It's not a sliding scale.
Public hospitals are partially paid for by canton-level governments, with insurers paying for the rest. Private hospitals are paid for more by insurers, with minimal public money coming from cantons for services that public hospitals can't provide. Government also subsidizes many other types of outpatient care, but to a lesser extent than hospitals. In 2011, public funding covered about 65% of all healthcare spending. The rest is private. Much of it is from VHI, which unlike SHI can be for profit. Often these can come from different branches of the same insurance company, a non-profit side for SHI and a for-profit side for VHI. Now, it's technically illegal for VHI rates and decisions to be based on information known through SHI, but it's reportedly hard to enforce this, so people can get screwed a bit. About 9% of healthcare spending is for VHI. Another 20% of spending, though, is for out-of-pocket payments. That's very high as countries go, almost 2 to 3 times what some other countries are paying. The Swiss don't have to have a primary care doctor and have a lot of choice unless they're part of certain managed care plans. In 2012, 39% of doctors were primary care physicians. About 60% of them are still in solo practices. If they're not part of a managed care plan, the Swiss have wide access to specialists. Much care is still paid for on a fee-for-service basis. Recognizing that much of life takes place after work hours, the Swiss actually focus on after-hours care, which is managed by doctors' associations. This is unlike a lot of other countries. The Swiss system is somewhat decentralized. Cantons and not the federal government are mostly in charge of healthcare system decisions. They are coordinated by the Swiss Conference on the Cantonal Ministers of Public Health. Quality is mostly maintained through professional self-regulation. Some quality initiatives have been begun, but almost all at a local or provider level. Costs in Switzerland are considered high. Of course, this is because they're only beat by the US, Netherlands, France, Germany, and Canada.
I have to say, this guy really throws a lot of like information, kind of scatterbrained information at you. It's a little bit hard to follow it all and fully comprehend it all. Maybe I'm just slow, guys. I'm getting the gist of it, though. Sometimes I just gotta pause and be like, okay, wait, that was a really important thing he just said.
Level. Costs in Switzerland are considered high.
I guess the cost of everything in Switzerland is kind of high, right? It tends to happen when GDP per capita is very high.
Of course, this is because they're only beat by the US, Netherlands, France, Germany, and Canada.
Okay. I mean, as a percentage of GDP. See, I mean, I don't know. I'm not trying to critique this video, but it's a little bit odd to be like, costs are high, and then Switzerland's down here where they spend a perfectly average amount of percent of GDP on health expenditure. I was looking for it up here. It's down here. It's actually less than Germany. Then again, this is, of course, as a percentage of GDP, not nominal. So I'm sure nominally it's higher than Germany or Canada. Anyway.
High. Of course, this is because they're only beat by the US, Netherlands, France, Germany, and Canada with respect to healthcare spending as a percentage of GDP.
How are you going to say they're only beat by those countries when... Wait.
US, Netherlands, France, Germany, and Canada.
Whatever.
With respect to healthcare spending as a percentage of GDP. So take expensive with a grain of salt. The Swiss are attempting to control costs with some regulated competition among the SHI insurance providers. However, this hasn't been working out so well. Many think that the system isn't equalizing risk enough, so some insurers are getting screwed by having to cover a much sicker population. Others think that the ways in which hospitals are funded and insurers are compelled to contract with all providers adds to costs. In 2012, risk equalization was improved. This year, incentives were also modified to increase efficiency. Managed care may also help cost control in the future. Drugs have to be evaluated for effectiveness and cost before they're...
Can I just say, going back to this chart, because honestly, this is what I'm thinking about. It's just hard to even fathom the fact that here in the US, I mean, we have the highest GDP in the world, and yet 17.7% is healthcare spending. Like almost a fifth of the GDP is spent on healthcare. That's just like mind-blowing. Whereas in almost every other country, well, all these other countries, is a tenth. And you guys, most of these countries, Switzerland obviously does have a very high GDP per capita, but you'd think with like a high GDP per capita, you might actually be able to spend less of a percentage of GDP on healthcare. I don't know. It's just crazy how inefficient our system clearly. It's pretty obvious it's pretty inefficient. Especially when you combine it with the stats about like, health outcomes. Child mortality and like how old people live, age expectancy. Like if we were going to be this expensive, it better have by far the best outcomes. And it doesn't.
Competition among the SHI insurance providers. However, this hasn't been working out so well. Many things contract with all providers adds to costs. In 2012, risk equalization was improved. This year, incentives were also modified to increase efficiency. Managed care may also help cost control in the future. Drugs have to be evaluated for effectiveness and cost before they're covered. Older drugs are reassessed as well. So what do people not like about the Swiss healthcare system? There's a huge amount of out-of-pocket spending, more than even the United States. In fact, it's pretty much the highest in the world. Wow. There's no tax breaks for health insurance, so premiums are completely on the individual. That 20% copay for drugs can be pretty stiff too. There's also no special program for the elderly. Some doctors complain that they feel pressured to keep costs down. If they're prescribing too many drugs or doing too many procedures, they can be investigated by insurance companies. And if they can't justify what they've done to the satisfaction of insurers, they can be forced to pay back some of the costs themselves. But while physicians might not like the oversight, there's much less pay back some of the costs themselves. But while physicians...
It's kind of weird because usually it works in the opposite way, but I guess in healthcare it does work. Like a lot of times doctors are doing stuff and then sending it to the insurance, obviously. So, yeah.
Satisfaction of insurers, they can be forced to pay back some of the costs.
But it's just weird that the hospital has to pay. Like that cost in the USA would go to the patient. If you get something done at a hospital and the insurance is like, we're not covering that. Sorry. You didn't need that x-ray. I don't think you needed it. You should have just stayed at home and let your arm heal. You would have to pay the cost of the x-ray, not the hospital. So I don't know. Yeah, I don't know. That's interesting.
Costs themselves. But while physicians might not like the oversight, there's much less bureaucracy on the patient side, and lots of Swiss like that. There are plenty of physicians, with 3.8 per 1,000 people, compared to an OECD average of 3.1. Unlike some countries, scanning technology is common. Wait times are short. In fact, in a study of 11 OECD nations, Switzerland was the second of the best to see a specialist and third best to have elective surgery. Access there is amazing. Life expectancy at birth is 82.6, which is pretty much the highest
That's insane.
in the world. Infant mortality at 3.8 per 1,000 beats the OECD average.
Yeah, see, these are two things I was just saying. So, USA 79.8. It's the lowest there. I mean, it's totally embarrassing.
Highest
Now, it's also because we eat a lot of McDoubles.
in the world. Infant mortality.
Infant mortality, 5.4. No, that's just sad, man. It's interesting that it's like also Canada. Like what's going on in North America that makes the infant mortality higher?
At 3.8 per 1,000 beats the OECD average of 4.3 as well. Their obesity rate is 8.1%.
That's insane.
That's unreal these days. Overall, in many quality metrics, Switzerland ranks among the best. In fact, it has a legitimate claim to being one of the best healthcare systems in the world in terms of quality. It costs more, but the Swiss seem to think it's worth it.
Okay, there you go. Of all the systems, I think that one is pretty inspiring, should be inspiring, and America should look toward it for some inspiration on how we could improve our system. if nothing else, it's like, okay, they're also spending a lot of money. So they spend it just like we're spending a lot of money, and it's mostly privatized, like, but they have better outcomes. So we should figure out why that is, because the accessibility is better, probably. All right. Thanks for watching. I'll see you guys tomorrow. Bye.